Okay, guys, now that
Go
we're
ahead.
live. Okay, so I'd like to have introductions. First things first, my name is Tasneem Islam, but you guys might know me as Dia. I am the host of this Zoom discussion, and I'm going to moderate the discussion, so if it goes too off topic, I'll reel you guys back in. There's a couple points that I want all of us to hit, and so I'll probably bring it up halfway through. But otherwise, I'm going to give the floor to introduction so we can get started on that. Who would like to go first?
I can go first.
Okay.
Oh yeah, so my name is Tasnia Islam, but most of you guys know me as Pia. I am the sister of the host. And whoever wants to go next, I guess, yeah. Introduce your name. Oh, we're from Florida. Yeah, by the way, we didn't know.
I can go next. So I'm Zaheen. So most of you probably don't know me, but I'm from Toronto.
Nice.
I can go next.
Cool.
My name's Aureen. My pronouns are he and him, and I am also from Toronto.
Welcome, Sabrina.
Hi, my name is Priyanka, and I am also from Florida.
All right, then the next is me. My name is Sanjita. I'm from Texas, and I'm the cousin of our lovely host and Pia.
Hi.
Okay. So, I have a background in sciences. My undergraduate actually was in biomedical sciences. So, for COVID, I have kind of had the knowledge of how it's spreading, all that other stuff. But I would like to know what you guys have. I know I tell my sister and I inform her, and I know Shanzi would have a pretty decent background because of her profession, but I'm just gonna let her bring that up.
Okay, so I did my undergrad in cancer research. And right now I'm working as a cancer researcher in MD Anderson in Texas. So yeah, I do have a certain background and knowledge of how this virus is spreading and how bad it is. Right now, I don't know if you guys listen to the news, but there was a discovery saying how this virus is being spread through the blood, and which makes sense in how this virus is really fast and hurting the person that is getting affected. So I don't know if you guys heard about it or not. I don't know. It's just me. But yeah, that's me. I don't know what else to say.
Well, in terms of knowledge of the COVID, I mean, I feel like for the most part, most of us have the general knowledge of how it's spread, how to prevent it, how to practice safer social distancing and all of that. But beyond that, maybe I guess more so on the microscopic level, I don't have the nitty-gritties of, how, I mean, I guess no one really does yet because we're still trying to figure that out.
Yeah.
Yeah, I have a math background, so nothing at all relevant to how COVID spreads or anything of that ilk. My work is in strategy, in business strategy. But I mean, it is impacting commerce in a way that no other pandemic ever has, and I think what it has done is kind of exposed a lot of the the underlying issues in our society, and that's kind of what my takeaway from COVID has been. So I've been trying to educate myself on that front a bit more in the opportunity that I have from just staying home all the time now.
Yeah, my background's in engineering, so not really health related. So most of my knowledge comes from either news sites or my parents telling me random facts that they found out.
I think actually, I know you guys are saying you feel like it's not as relevant, but I think this is the type of group we need. We do need engineers on this topic. We need business majors in this topic, and of course, we need science majors on this topic. But I think everyone has a little part to play, if anything at all.
Yeah, it's definitely going to help the more diverse we are as a group that's going forward, because we're going to need the math to do the epidemiology and the statistics of how this disease is spreading. We're going to need scientists who are doing the analysis of the data, and public health officials to help policy get enacted faster, diplomacy, all that stuff. And we're going to need engineers who are going to help build face masks for the people who need protective equipment. So I think it is all relevant, and we all have a place that we can do something. So one thing that we have done as a group is we started a GoFundMe, and our initial goal was $2,000. So we set the goal for 1 month during Ramadan, and we reached a little over $2,000. And when you pull the money from GoFundMe, you don't reach the exact 2,000. They like take a cut of it, unfortunately. So I took the money out and I'm transferring it to someone to send it to the NGO in Bangladesh. But one of the things that we could do is possibly fundraise a little bit further, because even after I said, hey, we reached our goal, a couple of people reached out to me and were like, hey, can I keep donating to your fundraiser? And so I was thinking we could increase the goals to a higher amount, maybe like $5,000 or $10,000. And if we all work and send it and like make it our own initiative, like this is my GoFundMe. So this GoFundMe isn't just exclusive to like say me, because my name was officially on it when we first started. But this group is everyone who joins, and it's our initiative. So this GoFundMe, when you're sharing it, you're like, hey, this is my initiative. I am participating in it. I was in a Zoom call. I talked to the people who are organizing it. I know the funds, and I know that we're aiming it towards protective equipment for people in the front lines, like journalists, doctors, and we're trying to get money to the poor who can't afford basic needs such as food. And another focus of the fundraiser was there's a lot of like basic medications for chronic illnesses like diabetes and hypertension, and these diseases, they don't just go away because there's a pandemic. So one of the focuses that the NGO Eminence is working with, they wanted to get medication out to the people who can't afford it. But also a lot of these treatment centers, they're not open at the time, or they're just like getting oversaturated with COVID patients. So we were thinking of getting just like generic medication like metformin overseas that we can collect, because I think production in Bangladesh for these medication aren't at the optimal level that everyone can access it. So if we could possibly figure out, like with all of our connections, I'm sure we can get something going on. We could help so many lives, you know?
So, I mean, the one thing that I'm thinking about right now, like one of my kalus, he works in like the medical department of, I could be wrong, but I think it's Square Hospital. Don't quote me on that.
I think
But
that's one.
yeah, I know that is a hospital there. So I will actually go ahead and talk to him a little bit more to see what his role is. And I feel like he might have some insight on what the medical field might need a little bit more. And I'm sure, you know, we have plenty of places where we can fund and help out in. But maybe narrowing it down to specific areas would also be helpful, because I know it can get a little overwhelming. Because it's hard, you know, everywhere is some kind of assistance is needed. So I can try to get some more insight, I guess, on the medical aspect.
That would be really amazing.
Yeah, so one thing that Mahir mentioned, he's not here right now, but he mentioned that in the UK, like a lot of the channels that they have are like Bangladeshi UK channels, because there's so many Bangladeshis in the UK. And he was mentioning how that like on TV they would broadcast that there's like a live donation going on, like that money would be sent. So we could do something like, you know, like a lot of American Bangladeshi, and not just American, like anywhere like NTV or ATN are like broadcasting, we could like ask them, like reach out to them and be like, hey, can you like advocate more for like donating to Bangladesh and stuff like that.
So, Thea, in terms of the GoFundMe that you have, do you mind just talking a little bit more about it and like being a little bit more specific about? I know you're the cause, but just like more.
So
yeah.
I was reached out by Eminence. They're the ones who are helping with the tech information, and they're an NGO in Bangladesh. They're actually located in Dhaka, and I was talking with the CEO, and he wanted to help organize a relief fund, particularly for oh, she disappeared, for Bengalis who need the assistance, and there's just not enough PPE for health officials that I even saw in my own family's experience. Like my grandfather, for example, is in the hospital, and the nurses who were taking care of them were afraid to go near him, even when they saw that he was COVID negative, and he developed like these awful bed sores because they're just terrified of like approaching a patient. And if that can happen to someone who's my grandfather, where we have like a couple of good connections to check on him, I'm just thinking of how much worse it can be for other patients who are in like a lot of these public hospitals that don't have as many resources. Like the access, the safety of like health workers are also like on the line. Like we keep seeing these stories of these really big doctors that are treating all the patients, they're getting sick, and their family, like their wives, are getting sick as well. So if we can prevent that and like decrease the stigma of COVID, it would help so much in getting people to actually go out and like help the patients and not be afraid, you know? So PPE is like one of the biggest things that like Bangladesh is lacking on right now. There's also just basic food. Like they can't afford to get their wages because a lot of these factories are shut down because of COVID. Like factory workers and like the garments factories in Bangladesh, their livelihood is being put on hold. They're not having like a way to feed their children, and so they have to decide between, do you risk getting COVID or do you risk your children dying from hunger this week? So it's like such a intense, like it's like a bad dilemma that they have to go through, that I feel like we come from such a place of privilege that if we don't do something, it's just unfair, you know?
I feel
I'm
like
glad you raised. Sorry, go ahead.
Go for it.
Oh, you can go ahead.
Okay, thank you. One of my close friends, actually, Bengali guy, lives in Bombay, and I don't know if they still like have cross-border trading between India and Bangladesh, but I know his company. So he works at a startup, and they are primarily like a manufacturing startup, and they've been supplying all over India for like they've been supplying PPE to all over India, especially like the poorer states that have been hit a fair bit, the rural communities, the Dalit communities as well. And if there is, you know, it's still cross-border trade or whatever, or any like if goods can be shipped across borders, then maybe he's a resource we can kind of use. He's a very close friend of mine. I grew up with him. So
that's an amazing resource. Yeah, and it would be faster than shipping it over from the United States or Canada.
Right.
So,
and I know that he works like day in, day out right now trying to ship stuff all over India. Like their offices are in Bombay or Mumbai rather. But they're sending stuff to Chennai, to Thiruvananthapuram, Kolkata, everywhere else.
Yeah, no, that's incredible. That's something maybe after the discussion we can have like a particular group chat, try to get that going.
Sure.
And if anyone wants to participate, helping the logistics or whatever, you can join us or comment under the chat box, because I know there's a live feed going on Facebook if anyone wants to help out. I know Zahin was going to say something. I don't know if he said it.
Oh, yeah. So you mentioned how like PPE is a big problem.
Yes.
But I also think like distribution of knowledge is also a really key factor,
Mhm.
because people are either afraid or overly confident because of what information they have. So people will be confident that they won't get COVID because they're like drinking like salt water or something. And that's a pretty
Mhm.
dangerous thought, because you can
Yeah.
get it and spread that same mentality to everyone you live with. And then since it's coming from people you live with, it's more credible, or you feel it's more credible, and it just
Mhm.
spreads that much faster. Because like I have family that are like they're all educated, and they'll hear this from other family members, and it's like, oh, it must be true. It came from them, right?
Mhm.
Mhm. Mhm.
And I feel like I think that's like almost as important as equipment, because if people aren't knowledgeable about what's happening, it won't really help as much, if even if they have the equipment.
That's
Mhm.
true. We had a discussion about that in the last Zoom meeting that we had. It was about outreach to particularly vulnerable communities. We were talking about how there's like alcohol waste in some manufacturing or production companies, and how maybe we can raise a fund or help the government create a policy that will allow them to create these products that the people need. And we were talking about how it could become overcrowded, so you'd need to tell people like what are the safety issues that you need to be cautious of. And when you want to talk to people, one of the best ways of reaching out to them is to have someone from their community reach out to them, someone knowledgeable. And
Mhm.
so one of the things that we were discussing is someone from the NGO can go and particularly educate like every single person, or like one head boss of the factory that's working. So one of their leaders that the community over there feels like represents them and understands their issues. So it would be like a much more personal way to approach them. And there's a lot of science illiteracy in most people. If you're not like
Mm-hmm.
going into science like as a major, you're not going to
Mhm.
have that understanding. And so a lot of us, when we're seeing like the news, we can understand it because we do have the privilege of like being educated to a certain level. But there are even like my friends who aren't science majors, like some of my friends are journalists. They have a basic understanding of science, but when it gets to a little bit more of the complex like mechanisms of how the disease is spreading, it's not as easy for them to understand. And so we have to like figure out how to make it clearer and more like concise. And that can also be something that we can create as a group. Like some people, like maybe Zahin can like get people, I don't know if in Canada or even the US, make an initiative and we can get that started.
Mhm.
So we talked about it in one of my group chats. We have like a group of Bengali kids, and we were discussing like about sending like healthcare workers who would go to like garments factory, like to
Mhm.
the workers there and like educate them and stuff. But like also when they're there to talk about when they talk about like basic hygiene and like washing their hands and stuff, if we could like somehow distribute like bars of soap or something just to like they take it home with them and stuff like that. If we could somehow do that, that would help.
Like make a poster or something, like an easy to understand poster for our like people in back home to understand like how this virus is getting spread and what we can do to combat it. Like, you know, something like they can understand. Because I don't know, maybe it's a naive question, because I don't know how the people back home know how serious this virus is. Like, does anyone
Mhm.
know? Um, I don't know if they understand like this virus can be spread like really fast if they're not social distancing, you know, how we're doing here. But I just don't know how it is. Does anyone know?
I've I've seen like two sides of it. There's like
Uh,
one side that's like overly cautious, and then there's people who just don't
don't
care.
don't care or
And
don't know.
or yeah, both. And when you see the overly cautious people, it's like a good thing, but at the same time, a lot of the people who are overly cautious are not at risk.
Mhm.
So the people who need the help, they're not getting it because the overly cautious people are the ones who are like younger and less at risk.
Mhm.
So it and the people who are getting like less of the news tend to be the ones who can spread it more often.
Mhm.
So we have to focus on getting that knowledge like at different levels, possibly. Like maybe something that we can do is we can all create like individually either a page just writing about the COVID, what we know, or someone can create a graphic, someone can like work with another team member to like help the Bangla be more like, I don't know, less formal. I don't know if formal
Mhm.
is gonna be helpful or informal. I know
Easy
there's
to
just a lot of
understand. Just
Mhm.
something easy to understand.
yeah,
Right.
I know there's a lot of
Yeah.
formal stuff that's like being published from the government. I don't know if there's any informal types
Easy
of
to understand.
graphics, you
Yeah.
know.
Something that doesn't have any statistics, like R square, like this is what's
Yeah.
gonna happen. Like
Yeah.
normal people won't understand what that means. So I feel
Yeah,
like we just need something that's really easy to understand, like just simple, like
Or we
simple.
can make
Hey,
like, if they can like show a video, because a lot of the time some people like, we're lucky enough to like be able to read and like stuff
oh
well.
yeah,
Like some people would need like a visual, if we could send people out there to show like a video, or like, yeah, the graphics that you were saying, not everyone can like understand or read it. Like sometimes like a lot of the stuff that we're seeing, like I know kids my age who like see
Mhm.
posters with like COVID's like general data and stuff, and they don't even understand, and they're like what does that even mean? Like what does this mean?
hmm
So in
That's
terms of,
interesting because
sorry,
sorry,
go
go on.
ahead.
Go on. No, please.
Go for it.
So I was just going to say, like, from based on what we're saying, it really seems like there's, like Dia said, there's two sides. There's really one side that's on the extreme end, and some are obviously cautious in the appropriate way, but some are basically creating hysteria by, sharing news that isn't really true. And then there's obviously the side where, they aren't as informed, so they might not give the whole caution towards COVID. So I think right now, like, as we're brainstorming, we have to come to the middle ground and try to help the people that are being extreme, which can lead to some dangerous, I don't know, like uh, practices basically. And they might start drinking something they're not supposed to because they think it helps them. And then we need to also bring together the community that doesn't really understand the effect of this disease spreading. And I think definitely infographics will help. And maybe if I don't know about everyone else here, but I do have a lot of cousins in
Mhm.
Bangladesh, and I feel like maybe we can go reach out to our cousins, our chachis, chachus, khalas, and everyone, to see what they know and what they feel like needs to be learned. And then based on that data, we can kind of gear what we want our posters to say, and then share it with them so that they can share it with their networks. And then that's how it will, obviously build a platform to help people understand easily.
No, that's a good point.
Mhm.
Arin?
Yeah, I was gonna say I've seen some literature that like through social media that some of the political parties and like leftist groups that I know work in North Bengal are using right now to reach out to like underprivileged communities there.
Yeah.
So I can see if I can get my hands on those. I have like an aunt through marriage that works in that region. She's a journalist there,
Yeah.
or works with that region rather. So I'll see if I can get a hold of that and maybe use that to shape our thinking, because that's already being used with
Yeah.
underprivileged Bengali folks just in North India.
That could work.
Mhm.
So we won't have to like brainstorm another idea because it's already created. We could just take information from there already.
Yeah.
So that's a good idea. I was thinking about how, so the reason that like we're doing all of these is to start a discussion, but because we're all here on one platform, connections and just like brainstorming and getting people connected is a lot easier. So we have this one group created, and I was thinking that if we expand on it, instead of like breaking off into really small, like little factions, if we just all work as a group, I think it would be a lot more effective than if we had like 7 different groups that broke off. So a thing that would help a lot is that if each of us can find like maybe say 5 people to add into the group who want to participate, who have like any ideas, who just want to even stay updated on the news, and we just add them to the Facebook group. They can be in Bangladesh, they can be in Canada, UK, Australia, US, and that would help us increase the community, and we'd have more participants who would watch the videos, and then they'd be able to have different inputs. Like for example, like I just didn't know that someone in India was creating masks. Like if Aryan didn't tell me, I'd never find out. And like these connections, there's just gonna be misconnections if we don't like get more people involved. And the more discussions we have, the more Zoom meetings we're having, I'm getting more knowledge. I'm able to spread it to be used more effectively. You guys are getting more informed. People in Bangladesh, if they want to rewatch the Zoom or whenever they have their free time, they see it. They can also see what the mindset is of the diaspora. And so it's maybe we can like help with expanding the group outside of just like what we're doing.
Networking, I feel like, is the key here. We obviously want to reach a larger crowd since we want to spread awareness. So in terms of like bringing more people into this platform, is there a specific like Facebook group targeted for this specific cause?
There is, and I will send you the link on it on WhatsApp.
Okay.
Or I can send it on Facebook. Yeah.
And what's like is there a specific mission or purpose of that platform? Is it really just to bring all these ideas together and kind of like brainstorm there, or is it more so like already established?
So brainstorming is like the main thing that I'm doing with all of our Zoom discussions. There are other Zoom discussions, like if you go into the chat, you'll see people in Bangladesh, like health officials and doctors who are having their own discussions of what they can do. And they're talking with people from Germany or like Switzerland, possibly from the UN, just seeing what they can do as gathering resources, information, etc. So there's like multiple things going on, but it's all in one group, which is so like you don't have to go to different sources to find out like what's going on. It's just one chat. You can see everything that's happening to Bengalis. And I know that it's mainly for Bangladeshis, but I don't know if there's anything we can do for our brothers and sisters in Bengal. Let me know, Aryan.
For sure, yeah. That's what I was kind of wondering. Like, I know like our conversations cater towards Bangladesh, and I don't want to take away from that. Like, so that, I mean, that's our decision to make, and I mean your decision to make, really. But I do know like the people I'm thinking about that I would want to bring into this discussion. There's a lady here who's a friend of my mom's who is a professor at Ryerson University in Toronto. And she Shutoma Ghosh, like she's a Bengali professor, and she doesn't teach Bengali, she teaches geography there, but she's very well aware of the issues in India and like how we can reach out, and she works with like a lot of universities in India as well.
Yeah.
So I feel like she would be a person we could bring to the discussion. I have a few other friends who, you know, are transplants from India that live here in Canada for as students or otherwise, and they're all very like concerned about what's happening back home and how they can, you know, help shape the conversation there, especially considering I don't know how, like obviously Amphan hit both India and Bangladesh, but I know that has seriously like derailed a lot of the government and nonprofit efforts towards helping with coronavirus. So that's kind of like the next couple of things I'm thinking of that I want to bring to this discussion.
That's important. So we can work on doing like an inter-country.
Yeah.
I don't know the exact terminology.
Maybe like an international effort. Like I mean, I know that this is Bangladesh specific, and I mean, I wanted to be something you guys like think about as well, because
Yeah.
like India has a habit of like entering this and just like taking it up and making it about India a lot. And I
Yeah.
just want to be cognizant about that.
No, thank you. No, but like you guys are also Bengalis, so like
Right.
yours are brothers and sisters over another border.
Good. That's how I feel about it too.
Yeah.
Okay, so I am going to add everyone onto the Facebook group, but more importantly, I was wondering what everyone specifically thought they could do for Bangladesh in their regions, because I know that in Florida, in Central Florida at least, I'm talking to people, and my sister obviously because she lives in the same house as me. We're both reaching like a similar group. In South Florida now we have Priyanka, who can reach out. I know there's a lot of Bengalis in South Florida. So if there's anything you want to do specifically,
So, in terms of, I mean, I'm still soaking in everything and trying to see what my role can be in all of this. So, for as of right now, what I really want to do is just kind of collect more data on what's going on in Bangladesh and what the situation is on COVID there. And although, like, you know, we know the general news and we know generally what's happening, I guess for me, I really do want to reach out to, I mean, I have been talking to my family members and seeing what the situation is, but get more, I guess, scientific data on what's going on there and what they're lacking. And then once I can figure that out from at least the region of where my family lives, I can bring that to the table here. And then in terms of me being in South Florida, there is definitely a huge Bengali community here, and I hope that I can bring as many networking aspects as I can to this group from there. And then, as you said, there is a GoFundMe. You know, that's like the most basic level. We can help out by at least sharing that and bringing that to light to everyone around us. So, I mean, I wish I had more I could like just put on this table, but like I said, I mean, I really do want to learn the situation better there. So yeah, hopefully next meeting I'll be able to share some more insight, and we can all share some more insight since I'm sure we all have family all over Bangladesh. So yeah.
So you're talking about data. From the data that I've been analyzing, it seems to be that the more testing is done, the more data we're getting. Like without testing, we're not getting a trend in the data. Like the data of like deaths or positive cases is following the trend of how many tests are being carried out. Like whatever, if the testing is doubling in 1 month, then you'll see that the death rates or the positive cases are doubling. You see testing is tripling, like the total in Bangladesh, then you'll see that the positive cases are also tripling and the death rates are also tripling. So testing is probably going to be one of the biggest things that we can do. Like widespread testing would be the best way we can get like hard data on the situation. And I don't know what other countries are doing specifically. In the US, we're not really taking this very seriously, so I can't speak for us, unfortunately.
Especially Texas, nothing's doing like what's social distancing? Nothing. I don't know.
That's incredible because in Canada, like things have been very different. We've had a situation of emergency, like a state of emergency called for our province until June 2nd, which is tomorrow, and then today
they extended it again.
Another 28 days, so it's going to go to June 30th, and it's social distancing. The only time that I broke curfew, so to speak, was the protest that happened a couple of days ago for George Floyd, obviously. But outside of that, it's been very much surgical with how they're making sure that everybody stays in. In fact, the more leftist your government, the more successful social distancing has been. The NDP, which is our socialist party here in Canada, they run the government of British Columbia, and they're the only province to currently beat estimates week after week. So, I'm hoping that's a lesson for a lot of people.
That is pretty amazing. For us, our social distancing is week. But it's kind of funny seeing that the social distancing people who are afraid and saying that their rights are being infringed on because they're wearing masks, these are the same people who, now that because of the protests that are occurring in America because of George Floyd, we have curfews going on. Like in Orange County, where I live, we have a 5 p.m. curfew, which is really early and ridiculous considering
Right.
how many essential workers are going out daily and returning home like around 8 or 9 p.m. So now all of a sudden everyone who was a naysayer is fine with it. So I don't know.
It's bizarre.
It's a difficult situation. It's very, very tricky. But yeah. Texas,
Texas.
what can you do?
What am I doing? So currently I'm just doing the basic, just donating to different causes. I don't know if you've heard of Project for Humanity.
Mhm.
Another cousin of mine, she's running that. Amy, she has that. So she has like a little platform there to help with the COVID with Rohingya Muslims. So
Mhm.
that's what I've been doing. I've been just donating, just to, and then tell people to wear their face masks outside here in Texas. When I see people outside, I'm like, please wear face masks. That's what I try to do. But I haven't done anything specifically for Bangladesh yet. So I hopefully like this platform can help me do something more.
Mhm.
I believe prevention is key.
Yes.
Knowledge is key, especially to our like countryside Bangladeshis. And like so that's what I think we should do, like prevention. Like sure we can get the PPE and everything, but if we don't make them understand this virus and how to stop it, this PPE, like they can, like, you know, like they can wear it for 1 hour and then go ahead and like take it off because they think that it's like done already. You know, like I don't know. That's what I believe.
Yeah.
So,
Yeah,
Yeah.
I agree. I think primary prevention is key here as well. I mean, there's lots of keys to this
yeah.
obstacle right now, but
Yeah.
I think that we should have, even though this is one big platform, I think there should be definitely a group focusing on spreading awareness and like basically like not factions necessarily, but using one big place to have like mini groups in that big place
Right.
to target specific goals, right? So for example, Zaheen was mentioning making like posters and spreading that awareness. So like I'm just saying, like as a suggestion, like he can be like a part of that group trying to lead it towards that cause, and then another group can be like towards finding more data and statistics on how what needs like main focus. And then like a side note, Sanjita just reminded me, actually one of my really really good friends, she's from South Florida. When the Rohingya camps opened up in Bangladesh, she raised about $7,000 for them, and then she actually personally went there herself and kind of made it like a mission trip to visit those camps and basically distribute the supplies to the camp and the vaccinations and different types of medical assistance they needed. So I can definitely talk to her more about that to see, because I feel like she would have more insight on how to properly get that distribution going. And then I guess in terms of our goals right now, maybe we should try to like kind of collect what we've discussed and then kind of give each other a more defined role, perhaps. Yeah.
It's actually like, sorry to build off your point, Priyanka, like it's something that we use a lot here. There's an environmental group I'm a part of called Extinction Rebellion, and it's basically just a group that's trying to fight climate change and extinction, human extinction as a whole. And the way it's structured, it's also like, it seems like a loose group of just individuals that care about this issue. And the organization's divided up into little factions as well. And people are encouraged to not kind of overcommit by just committing to one to two factions at most.
Yeah.
And the factions are pretty, like, I think everyone like kind of would probably ally with it. Like one is media, like there's always media that you got to work on. There's logistics, which is another piece we've talked about. Another one is like public outreach, but that falls sometimes with media as well. So that's another one. And then there's like arts, they call it, which is just people doing crafts or installations or whatever, you know, you could think of. protest pieces, whatever. So it's just it's a line of thinking we can also probably co-opt. I'm entirely with you, Priyanka. I think like
So what I'm thinking, like, since Dia is the host here, so of course, she has the most background knowledge on like our mission and basically the initiative itself. And I was thinking maybe we can try to see each of us what we're best at in terms of what role we can play here, and then from there, kind of not necessarily just focused on that specific role, but kind of try to collect more to build that role, like for example, I feel like I can have a lot of connections from South Florida Bengalis about how to distribute certain things, or how to even just build a bigger platform for donations, like $7,000 I feel like was a lot to collect, and I feel like if I go down that same route, I'd be able to also reach those numbers and expand on that, you know what I mean?
Yeah, I think that's like a good point. I think we can reach 10,000 if we all try, because we have 5 people speaking today, 6 if you count me, and then we had 4 other people in the last discussion just of diaspora kids, and we're not even counting like Bangladeshis who are on this group. If we all figure out people to donate, if we all get $10, that's going to be a huge thing if we snowball that effect down, because it's just a small donation. Like our donation that we did, a lot of tiny donations built up to that $2,000. It wasn't just like a bunch of people doing 500 or like 4 people doing 500. So sometimes we tend to like underestimate what our individual donations or abilities are going to be, but when we work together as a collective, as Arun was mentioning, the movement gets stronger and we get more cohesive, and it's not all over the place. So yeah, I completely agree with Priyanka. A media group would be great. Possibly, I know there's already an outreach system happening, but outreach, I think if each of us individually can get 5 more people, that would be the best thing. So whenever like we do a Zoom call, we introduce 5 more people, so we can introduce them to the concept of these Zoom calls and get them involved, have their own discussions, for example. Like then you guys can help have those discussions on a different time. And media and arts can be like, arts and media are kind of the same sometimes though, right? They have a lot of overlapping.
Maybe in terms of like graphic design and kind of like reaching the crowd more would be more so, I guess, art.
Yeah.
So the way media works for us is so it's a big organization, right? There's like thousands of volunteers, and I think we don't have the luxury of like everyone being just one thing. Maybe we just have to be a little bit of bleeding between us.
Yeah.
But, so media typically deals with PR stuff, with like reaching out with press releases when we're doing an action, or when we're protesting, or whatever it could be. And then on the other side, the arts function is typically like working with local artists to create things that we can protest with, around postages, signages that we can put up. It's slightly different because media is more of like what we call media is more generally like the mouthpiece of the organization. It's more just communication focused, more of like how the organization is focused.
It's a lot more journalism based.
Yeah, I would say that, because the guys that run media are typically like PR type guys that have worked in PR type roles across corporations, to be honest. But Moonlight is this.
Thea, do you know Sana from South Florida?
Yeah, Sana.
So, so she, I feel like, I mean, I'm gonna try to reach out to her and see if she would like to be a part of this initiative. But I feel like she has a pretty big voice in South Florida in terms of media and journalism and all of that. So I feel like it's like that, like we should start thinking about people in our lives and what they're known for, and then start to basically bring them into the platform and give them their part in it as well.
Yeah, I follow Sana on Twitter and on Instagram, and I don't know if she's our cousin or not. but
My
she was
cousin?
there. I don't know if she's my cousin. Or not.
Oh.
She was at my cousin's wedding, so I don't know if she's related or not, but who knows? I feel
Oh.
I think one thing we should do is definitely talk to our parents and stuff,
Mhm.
or like
Yeah.
our older relatives, and get
Mhm.
them to get their whoever they know involved, because they also have like a big community within like Facebook itself. Like they probably have their friends who live in wherever they live, like Bangladesh or something, and they can talk to their connections, because we're reaching a lot of people who are young and stuff, and it's like we're doing as much as we can, but they might have more networking and more capabilities to help than us.
Mhm.
Yeah, I mean, after all, it is their like motherland to begin with.
Yeah.
That's how it came for us. So
I feel like
yeah, go ahead.
I feel like on the topic of information, Bangladesh has like a really good cell network and internet network. So there, like a lot of Bengalis are connected to the internet. So I feel like we should leverage that in some kind of way, like as a website or I don't know, mass texting. Like a lot of information spreads via websites
WhatsApp.
or WhatsApp. Yeah,
Yeah.
like WhatsApp groups.
So just to kind of like, I mean, organize my own thoughts and like our brainstorming. So basically what we have here is that we want to organize a way to spread more awareness, correct? And then we also want to reach a bigger target audience by bringing in our own networking and our own Bengali friends and family into this platform. And then I guess the third thing would be to kind of not, I don't want to use the word like divide up the task, or not, I guess divide up the task and kind of have our own little areas where we are going to focus on a little bit more.
So we would have separate group initiatives. Possibly you can have like different WhatsApp groups, like side groups, and then we can have maybe like a mass chat for everyone who's in this organization. And then we can just like maybe not maybe we could do once a day, like just be like, hey, I did this, or I didn't do anything today. Like that's gonna happen a lot.
We could do like at the end of the week, like a summary,
yeah.
of what we've done and stuff. Yeah.
Maybe like after the discussion or before the discussion, then we can be updated for whoever does host the next Zoom chat. They can see that this progress has been done. I don't have to bring up topic A or topic B, or I can bring up this group has started this initiative and they've seen this progress, etc. So that would be a really good thing to do. And if you guys would like, I can help you guys get moderator positions on the group, the Facebook group that we have, so that when you do add, you can add more people, etc. And if there's like weird posts that someone sends, and on the post approval, I just like delete them. There's some like spammy posts that you just have to X out. But yeah, I think that we have a really good thing going on, and the outreach that we have is going to be impactful. Something that I would like for all of us to do is think about other countries and how we can get that involved. I know you guys are the first two Canadian guys. So if you guys can get more Canadian Bengalis or Bangladeshis involved, that would be fantastic. And Bia, if you can get someone from UK, that would be great. Priyanka, Sanjita. UK has a lot of Bengalis, and I feel like that's like something we can really like outsource and get that force together. There's Bengalis in Australia, New Zealand. We can contact. There's a couple of Bengalis in Japan who, I don't know, they might have different information because Japan didn't implement as strict a social distancing policy, but their spread of the disease wasn't as bad as other countries. And so we can ask them like, hey, how is that happening? What's your personal experience with it? How can we co-opt what you guys are doing into our movement, etc. So
yeah, I'm sure
someone from New Zealand. Did you hear how they're like completely like recovered?
Yeah,
Right.
Yeah, we should need to talk to somebody from New Zealand. or maybe get the Prime
Any
Minister from New
Bengalis?
Zealand to come into this.
That would be awesome. I don't know how we get that.
Please, like, just beg her.
Also, our
Spam
outreach
email.
group, start working on getting the Prime Minister of New Zealand.
I think that's our main thing we need to get. Like make a link to our like Facebook group or Instagram and spam her. I don't know if she has any social media pages or not, but anyways.
Yeah. I'm sure we have cousins like who live in different countries and stuff, like who are Bengali or whatever. Like
Right.
ask them about their communities over there and like how they can help as well.
Yeah.
So I guess then let's say the biggest goal before the next time we have another Zoom meeting would be to just go and spread out to all the networks we possibly can. Correct?
Right.
Try to add 5 more people
Okay.
to this group.
Everyone's
So that
task.
would be our big task, and I'm gonna up the goal. I mean, I already pulled the 2,000. It's officially $1,920.
Mhm.
GoFundMe takes
Yeah,
like
GoFundMe is a
huge cut.
tax. Yeah.
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 So outside of that, instead of 2,000, I can increase the fund to 10,000, and then I can send you guys all the links and give you guys like whoever wants to do this. Obviously, if you don't want to do this, it'll be like a different faction, as Priyanka's been saying, someone for fundraising. Then whoever donates, what me and my sister have been doing, we personally put the name of the person and we sent like a little thank you message out to everyone who donated. So that's like a little personal touch that like affects people a lot. It helps them like feel good about their donations. Like whenever I donated to something and I got like my name
Sure.
personally messaged back, it's
Yeah.
impactful. So 10,000, 5 more people, and media. Like if you guys want to post anything, like you can do a page of like your personal experience of how COVID is affecting your family as a Bengali American or Bengali Canadian, or you can say just what knowledge you have on the disease, the spread of it, a graphic, art, whatever, just like to get like the content increased so we can share stuff as well, get more participation going on.
Mm-hmm.
Yeah.
That would be the main goals, and then the factions, which we can
You
break
can divide out
into
within the
in
WhatsApp.
WhatsApp. So media / PR, fundraising. I don't know.
Like so
Outreach,
logistics.
There's-
logistics. Yeah.
I just had an idea. Sorry, I know this is like a little bit off what we're talking about exactly.
Go for it.
Somebody in my network I know is a movie star in like Kolkata, and I think she has like a huge reach. Like she has like 250K followers on Instagram.
Yeah.
Maybe I'll reach out to her about like if we can get something together to be able to like just like a 1-page document that outlines how COVID spreads, what they can do to like prevent COVID, stuff like that. Just one pager. Maybe we can get her to post it on her Instagram story, and there's like hundreds of uncles that follow her, so they'll pick it up from there.
Okay. So next Zoom meeting, the actress and the Prime Minister of New Zealand.
Right.
Okay.
Stuff like that, I feel like that's what makes a difference, you know, like, and as you guys mentioned this, like I start remembering people that I know in my life too, and I actually realized that I grew up with a family, and their daughter, she is a very big Bengali influencer, and she has a couple of K followers as well, and it's people like that that can make a difference and shine some light on our cause.
Yeah. And
Hey,
I know that
aren't you? Don't you have a couple?
Anyone famous, whoever you know that has a great social media following, I say definitely reach out to them and try to get them on board with us. Yeah.
Yeah. See, we already have a leader for the networking.
Okay. So I'm gonna give the floor to everyone to say their last pieces, and then I'm gonna wrap it up because it's almost time. Arin.
I'm glad thank you so much for inviting me to this. I've been like trying to rack my head about like how we can impactfully assist the impoverished in Bengal. So like that's especially since I'm fun, like that's been something that I constantly wrestle with. And being shut in doesn't help with that at all. So I'm glad like there's something that you invited me to, Dia. What I'm going to do is probably take a couple of these takeaways. Maybe I'll try to see if I can build out like maybe in English initially and then translate to Bengali, like a slide deck or something where I can outline COVID. I'll add people to the group, no problem. And then maybe start talking to those people, like, some of us have already mentioned, people that I think we can bring to the fore and use as the next steps to expand in Canada and elsewhere.
Okay, sounds good. Priyanka, I know you have to go.
Yeah, in just a minute or two. Basically, I'm definitely grateful to be a part of this initiative. As for what I have to do before the next meeting, I feel like I have a better understanding. And I hope that next time we come, it's beyond the brainstorming we've done here. It's going to be like the actions of what we brainstorm.
Yeah.
But other than that, thank you so much for having me here and giving me the opportunity to also be a part of this help.
Thank you for participating. Zahin.
Yeah, so I was always looking for a way to contribute outside of like donations and stuff. So I was pretty happy to find this group.
Thank you for participating. Sanjida.
Oh, thank you for inviting me. I'm really grateful that this platform exists, that we can somehow get an awareness to our people in Bangladesh. Like I said, this is a very important thing. Thank you to Dia for hosting this. Thank you to thank you for the platform. Oh my God, thank you. I'm so grateful. I don't know what to do. And then so in the future, I'm going to try to bring in more people and try to like bring awareness in any way that I can. Anyways, yeah, thank you guys.
It was so nice to see everybody. Oh, Pia.
Yeah.
Yeah, thanks everyone for taking time out of your day to join this, and like all your ideas are like appreciated and stuff. My next goal is definitely to outreach and like get other people involved and stuff.
Okay, so I'm going to give the signal to end this. Hey, Tushar, can you end this video, please?
Bye.
Thank you. Great
Bye.
discussion.
Yes.
Bye bye.
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 Is it ended?